Good morning, DSTT community. This morning we're going to talk about ways to modify the hundreds exercise down to the most basic fundamental position. Oftentimes we need to make these modifications for neck injuries or cervical issues of the spine, such as disc herniations, step off, stenosis within the neck itself. Also osteoporosis. If you have osteoporosis within your spine, it's often contraindicated unless directed by your doctor or your physical therapist to avoid any type of deep flexion of any portions of your spine. So coming up into that chest lift and putting any tension on the neck or the back is contraindicated. So these are ways that we can modify the hundreds exercise down to its most basic position and still recruit the abdominals as well as the entire core and be able to use that exercise to strengthen and to our benefit without causing pain and discomfort. So what we're going to do today is completely take out the chest lift 100% from the movement. We're going to be laying flat on our back here on the mat, and we're going to start with our knees bent and our feet flat. Now I have brought in a small pillow which you could use between the knees to help shut off the hip flexors, especially if you have any lumbar discomfort, low back pain. If we want to decompress that low back, adding a pillow between the knees to help engage the inner thigh, activate those lower abdominals a little bit more, is going to help take that pressure off of the low back. And I'm going to go through a couple different leg positions that you can work your way up into. Think of these as different steps or levels to the progression to make it more challenging for you. And there's other things that we can also add to this. So as we start bringing our feet and our legs up into tabletop, if tabletop is not going to be a comfortable position for you, for your hips, for your back, you could add a small chair that you could rest your feet on, or if you have a physio ball, an exercise ball, one of the large round inflatable balls, you could use that to rest either one or both legs on top of to challenge your tabletop, but still provide you that support that you need for your hips and for your low back. So once again, we're going to be working on a perfectly supine hundreds modified exercise without any chest lift to keep the spine in neutral, train the abdominals and strengthen the abdominals, as well as get those shoulders back into a better position. If we can correct and strengthen a more natural neutral position of the shoulders and of the spine, that can take a lot of pressure off of the neck as well as off of the low back. So we're going to get started. We're going to lay flat on our back. If you want, grab a pillow. It's optional. You're going to place that pillow between the knees. Give your inner thigh something to hug against. And we're going to lay back, flat on our back. We're going to set our pelvis into neutral. So we want to make sure that we have that little tunnel of the low back. We also want to make sure that our rib cage is not flaring. So we want to drop the rib cage just a little bit, pull our abdominals in. We're going to float the arms above the mat and draw those shoulders down, straight down the side. So we're getting that tension along the back of the arm, through the underarm, along the rib cage, and into our core. And we're going to pump the arms. We're not bending the elbows or shrugging the shoulders, but we're working that nice little pump, that nice little pulse of the arms. If you want to add breath, I ask that you do this last. I want you to focus on your position and your alignment and your core engagement first before fixating on your breath cycle. So if you were to add a breath, you would go for 5 exhales for 5 pumps and 5 inhales, or a long exhale for 5 pumps and a long inhale for 5 pumps. To change this up, we're going to set the pillow aside and we're going to bring one leg up to tabletop position. And we're going to continue with those pumps. We're going to reset and we're going to pulse. So this would be another step in the modification, and you can alternate legs. To take it a step further, we're going to bring both legs up to tabletop. Again, if it's adding pressure to the hip flexors or to the low back, you can add a little pelvic tuck or add your pillow back between the knees to give you some more support to take it out, take that pressure out of the low back. We're going to reset those arms, reach long, and we're going to pulse. Drawing the shoulders down, ribs and abs in, and draw navel to spine. And as I said before, you can add a physio ball or a chair to add that extra support for your legs for the tabletop position. So more to come tomorrow with those daily newsletters of exercises and stretches for strength and for Pilates. Thanks, guys. We'll see you later.